Hi everyone, Sue here, and I'm just going to take a few minutes to talk a little bit about learning about learning. And so in this week, in the Nursing Bridge course, we're going to talk not only about the different methods of learning, but why that's important and where we find ourselves right now. I think for many of you, this is an unusual term and an unusual start to your program. For some of you, it may be actually perfect for your lives. And for some of you, I'm getting the sense it may be a little bit of a disappointment, or you may have a little trepidation. So you have readings for this week. It's important as we talk about university learning that, that I just put it out there directly. I'm not always, or Leslie's not always going to just provide the information that's in your readings for you. We're not going to distill it down. It is important to learn that skill of doing the readings, and you'll find this in all of your courses, doing the readings and then making sense of those readings, being able to pick out what's important. And this is a good place to start. I'm going to provide just a teeny bit of an overview here, but for you to be able to take that reading, it's not that long, and break it down. What's important? What do you need to walk away? Typically, as opposed to a pathophysiology or a microbiology course, I'm not looking for tiny, tiny little pieces of information. We're looking for bigger, broader ideas. And you find that much more often in your nursing courses, or if something is particularly important, often we try to cue you, but you are responsible for all of your readings, not just what we have spoken of in an online lecture or in handouts or in other kinds of material we've given you. So let's talk about the different kinds of learning environments. And that really is what dictates how we cluster them, but what is the environment in which you learn? First question here, where does learning happen? So I think all of us know it's going to happen formally in educational settings, a lot of educational settings, but you know where the most learning happens, and it's pretty obvious, right? Life, our life experiences. All the ways that we see new pieces of information, that we process them, pull them together with what we've seen before. We often come to a question without even realizing it. Where have I seen this before? And is there a pattern emerging? And that's a really critical question in nursing. Have I seen something like this before? And is there a pattern? So life teaches us so much of what we learn. We also go through informal kind of learning experiences that are not just general things that we learn in life through our family. And those could be things like joining Guides or the Boys and Girls Club of Canada, all kinds of different educational experiences. I may join a cooking club and really learn from how the facilitation happens. I may find that church is a place where I really learn how people communicate, not just the actual information about my faith, and my faith teachings, but also how people communicate, how they behave in a way that really supports engagement, things like that. And then those formal learning experiences. What we know is that authentic, transformational, do you remember last week we talked about transformation, right? That concept analysis of what is required for transformation. That authentic, transformational learning requires synthesis, and that means that it requires that we bring together ideas from all kinds of situations, from our own lives, from what we have personally experienced, from what we've read or learned formally, what we see in the world, and our own values and beliefs, and we pull that together, right? So it's not just what I've been exposed to, but other ideas that I'm learning about or seeing and mulling over. It requires that we reflect deeply, and that's why within the program there's a lot of reflection. I know all of you will have gone through that within your PN programs, and also as an RPN. Reflective practice is critical for all of us, isn't it? So it requires reflection and contemplation, and often in our busy lives there's just so little time to be contemplative. That armchair thinking, just to sit and ponder things. Wouldn't it be nice if we all lived a life where there was that time? I hope for some of you that is your life. Unfortunately for me, it's not very often my life, but it's really important that we try to carve that out. And so recognizing that the least effective way to learn is that unidirectional, let me give you the facts, you memorize the facts. It's least effective for so many reasons. One, it's just hard. It's hard to just memorize a bunch of facts that belong to somebody else, as opposed to making meaning out of information that I can assimilate what I already know. It's not effective because I don't become a good knowledge user, a knowledge broker, and that's what nurses are, right? We're knowledge workers because that information remains external to me. So I'm just, I take it in and I spit it out, but I don't make use of it. It doesn't become mine in an important way. So while many of us are so familiar with that idea of university education and the lecture that may happen, and lots of us really like that lecture, being able to sit passively and just listen. I sure like it, boy. It's not effective for learning. It's interesting, isn't it? Although I really like that. I like to be able to sit and chill and just take in what I need to, maybe multitask, be on, I know it's old fashioned, but be on Facebook or be answering emails, doing a whole bunch of other things. It's not effective. And so it's really important that we look to how can we most effectively teach in a way that's meaningful for learners. So let's talk just for a minute about those three most common learning environments that we use in particular in nursing, because you can see that with clinical and simulation, and how important that is. So classroom learning. Classroom learning is going to happen in a lot of different ways. Look at this term, right? So classroom doesn't necessarily mean that we are physically in a room, but we still call it classroom learning. Clinical learning, most of us have experienced that, very traditional way of learning in nursing. And I think to this point, there is, it's a mainstay of nursing education, but as Leslie will remind us, there's one program in the US that has now been approved to offer 100% simulated learning. So isn't that remarkable? And then finally, simulation or simulation-based learning. You're in a fantastic position, because I'm not sure if any of you know, but Ontario Tech U or UIT, Durham College and Georgian College are leaders in simulation-based learning. At a time like this, in the midst of the COVID, we really see the growth of simulation-based learning, but it didn't require COVID. We've been doing this for more than a decade, working intensively around the idea of simulation. And so I hope this is something that becomes exciting for you. So let's talk about these. Classroom learning, AKA, also known as traditional learning. So classroom can refer to face-to-face, and it can happen in a whole bunch of ways. It can happen with lecture. Remember we talked about that? One person, a lecture, a professor professes. They send that information out. And often there's, you know, these days there's PowerPoints, there may be speakers notes that go with it, but that information is pre-programmed. So typically in a lecture, the professor knows what they want to convey, and the learner is supposed to take up that information. It's important for some things for sure, but in terms of that authentic, meaningful engagement with material, it doesn't foster that as well. In terms of face-to-face learning, there's lots of other opportunities though. So to have class discussions, small group or large group, to bring in guest speakers, experts in the field, voices from practice, really important, and to have students engage with learning through student presentations and other things. And so by combining some of that transmission of information through lecture and professor presentation with those other elements, whether they are much more interactive and engaging, we move to what's known as collaborative learning. We all learn together. Students learn from each other and from the professor learns from students, we all learn from guests. That discussion and dialogue moves all of us forward, and that collaborative learning is critical to effective learning in nursing. Now, what about online learning? How are you all feeling? I would say before all of this happened, maybe maybe it's only within the last 10 years that I've really become comfortable and happy with online learning. I am not somebody who loves a wall of words. So for me, getting to a place where online learning was engaging and meaningful, where you could convey things that were critical, but engage in discussions without it becoming just a sea of people posting and chaos and feeling like I wasn't connected, was something that I had to work through and work on. So in terms of online learning, guess what we've got? Lecture. Lecture can happen like this. So I am speaking and there isn't an opportunity within this lecture for you to answer. So online it can happen the same way, and hopefully it's got some visual cues for you as well. And online we can have discussion, so we can actually have a written discussion, so that your small group work, right? You have discussion within your small group, discussion within the large group where you post and respond. We can actually have sessions like Zoom sessions or collaborate sessions or other sessions where you are able to work together and we're able to discuss things. And again, same thing, we can bring in guests, and that can be either live or it can happen through other kinds of video presentations, and students can do presentations. This week in your synthesis posting number 1, you're working on how you would create a presentation for some learners. And so guess what the result is? Again, online, collaborative learning. Same results. Data tells us that we all have learning styles, and our learning styles really affect how we perceive those learning experiences. But what faculty will try to do as much as they can within the nursing program is provide information in as many different ways that we are able to provide something for all of you. And I really hope that this learning experience becomes one where you feel engaged, where you feel like there is a place for you and you're not lost in a sea of learners and lost in that wall of words, but instead there's all kinds of different resources that we're using, and you feel connected to both Leslie as the lead, or myself, or there's a new TA in this course, and to each other, and most importantly to the material. So classroom learning, it's effective, whether it's face-to-face or online. Often our preferences play into that, but good classroom learning happens in any of those environments, and it really is up to the professor and the learners to work together to make sure everybody is receiving what they're intended to receive in a way that makes learning possible. What about clinical learning? Clinical learning is tied, its roots are very much in the apprenticeship model, where we learn on the job. And even as recent as the 1970s, or maybe early 1970s, student nurses were working most of their time as unpaid labor for the hospital, right? So you took classes, either within the hospital or near the hospital. And I think actually it was in the 1970s, 71, 72, that the last hospital-based school of nursing closed in Ontario. And in the United States, they still have some hospital-based schools of nursing, so hard to believe. But within that model, you are tied absolutely within that apprenticeship focus. You learn so much right in that clinical setting. There's value in that because you become very adept within that institution. The challenge is often, though, that you learn how to do things in one certain place as opposed to how things can be approached from a variety of settings in a variety of contexts. So within clinical learning, there's supervision that takes place, and it can happen 2 ways. And I know you all know this as RPNs. So with direct supervision, so a clinical group in a clinical setting, and you have direct supervision as that clinical instructor, helps you to ensure that you are able to apply the skills that are necessary to meet the competencies of that clinical course, and then also helps you to become more independent within that setting. There can also be indirect supervision, and typically that happens with a preceptor model. So you have a preceptor who you're working with as opposed to a clinical instructor directly on site. We've moved away from having a required number of hours. CNO used to have a required number of hours within a variety of settings. And in the United States, typically the boards of nursing still have those required hours, to now saying that programs have to determine and show evidence that their learners meet the entry to practice competencies. And that's why we come back over and over again to those entry to practice competencies. So it's not a specific number of hours, it's to show that your learners are capable of meeting those entry to practice competencies. And that can be very different in a variety of programs. And the number of clinical hours, because of that model, varies. What I will say is that Ontario Tech, in partnership with Durham College and Georgian College, offers one of them, it's one of the programs with the most number of clinical hours, clinical experiences for learners, because we think that's important. Within the bridging program, you have 4 clinical experiences. You'll do a life transitions course that's offered in the summer. You'll take a community course. Community nursing is the hallmark of a BSc in education. You'll take that in the summer. And then you'll do a synthesis praxis course and your final praxis. And both of those will be preceptored. And then the interesting thing is we assume clinical learning is critical, right? Absolutely critical. But I just said one of the universities in the United States has been approved to offer 100% simulated learning. Well, how can that be if clinical learning is essential? And now we're in a place where we don't know how many hours of clinical learning are essential. If we're meeting competencies, how can programs have clinical hours that vary by hundreds of hours? How can that be? The reality is we do not know what the dose of clinical learning is for effective outcomes. We don't know specifically how that works. One of the most important thoughts that somebody mentioned recently is when you're thinking about clinical learning, wouldn't it be interesting to have that time study that looks at exactly how much time was spent on a variety of things? And when you look at that 8-hour shift, we may really bring it down. If you've got a post-conference, take that time out. Practicing nurses often don't have time for lunch or breaks, but students typically do, so take that time out. Is there report time? Take that time out. Is there time where your patient's doing something and there's not really, and you can do a little bit of research, but does that have to be in a clinical setting? So when you look at the actual day, and sometimes you're doing nursing activities, but they may be activities you already know, you're well qualified. So for example, you may be doing making a bed and getting the patient's room ready for the rest of the day as the patient is off having an x-ray. You know how to do that. So doing that again is part of your job, part of your role, but is it promoting your learning? I don't think so. I think all of you already know well how to do that. So when we look at what happens in those clinical hours, how many of those 8 hours are actually active learning, it would be interesting to know, wouldn't it? And so we come to simulation-based learning. Really, the advent of simulation-based learning is hundreds of years, if not longer old. Started with things like war games, right? When in old days, military people wanted to simulate what would happen through a variety of maneuvers. Where we have advanced to, and just a classic example, I don't know if any of you could possibly be as old as me, but when nurses were taught how to give injections in the old days, and they actually gave their first injection typically into an orange, simulated learning. Now we've moved into an era of much greater technology and realism in simulation, but it still is that same principle that we are learning to apply concepts and practice standards in a setting where there should be an element of realism. We should feel as though the situation is realistic or possible, and it's remarkable how we often can move into really feeling the situation emotionally, cognitively, like we're thinking through the situation, psychologically, experiencing the thoughts and feelings that might happen in a clinical situation. And so that's really important, that there should be those elements that are occurring within a simulation that lead to that greater learning. Simulations can happen face-to-face, and that's just traditionally how they've happened. And I'm not sure how many of you have done a great deal of simulation in your PN programs. Often simulation is done in a way that it feels a little bit nerve-wracking, right? So somebody's watching you, your heart is beating, you're trying to make sure you don't make any mistakes. And it feels like it's always a test. Simulation under duress is psychologically traumatizing. Our goal in this program is absolutely not to psychologically traumatize you. Nursing is hard. Simulation can be hard, but our goal is to foster learning, right? Isn't that what you expect from us? Our goal is to foster learning. And so at this point, we're not doing face-to-face simulations because none of us are on site, but at some point, I sure hope you have an opportunity to work through those with us. Right now, we're doing virtual sim. And virtual sim is where you engage with a clinical situation, either through watching a video, playing a game, and it's hard. Gaming is kind of a difficult word to use because people think gaming is silly or light or not really taking a situation seriously enough. But it comes with that idea of serious gaming. It falls within that critical thinking, problem-solving approach that comes with serious gaming. And what we know is our brains require a variety of modalities to really engage with the situation and to make it memorable, to make that learning stick. So virtual simulation is a modality that's well established. Through COVID, particularly across Canada and the United States, that element of experience has grown and will continue to grow as we move our way forward. One of the real benefits to simulation, not only is the actual learning that happens, and we know the learning is remarkable. So if you want to know where the evidence is around clinical education, it's with simulation. The evidence is remarkable in showing that it is effective, that learners engage in situations, they learn through the situation becomes memorable, they're able to synthesize and develop greater confidence and competence, which is exactly what we're looking for. But in simulation-based learning, what we know is that you're able to engage in what's called high stakes, low frequency events. And I always say, I'm an emergency nurse by background, the first time you look after a patient having a heart attack shouldn't be in the emergency department. that should be in our simulation lab, or at least virtually in a virtual simulation. So there's no risk of harm to the patient as you work your way through a situation that you may not see very often. Also, we can use broad concepts, communication, team building, and other things that build or become a synthesis simulation that build on all kinds of other learning. So there's lots of opportunities. Elements associated with a simulation or simulation-based learning, particularly within our program, are those that are listed here. There's going to be some kind of assigned preparation. That could be reading articles, going to websites, doing things like that, watching videos, YouTube videos, or other kinds of videos. But there is some kind of preparation that's necessary. It's also really critical that you do a pre-simulation self-assessment. You really want to understand where you're at before the simulation, and we'll talk about that again in a second. Then there is a pre-brief. The pre-brief can be live, so someone can be talking to you virtually, or it can happen through a recorded message. And the pre-brief really sets you up for the simulation, lets you know what the objectives of the simulation are, how this is going to unfold, what you can expect. Because if the situation is always a surprise, it's hard for you to move beyond the surprise to get to the learning. So the pre-brief really sets you up for the situation that's going to unfold and how it's going to unfold. Technologically, if you're in an environment that is virtual, if you were in a real lab base, a pre-brief would involve use of the equipment and how that equipment works. Then there is the simulation experience. Again, it could be a face-to-face simulation experience. We're running a situation of a patient having a cardiac arrest, or the simulation experience could be virtual. In the same way, we're running a simulation in which a patient is having a cardiac arrest. So most simulations can work in either kind of setting, and depending on the situation, you're going to determine the most effective route by which you want to offer that. Following the simulation experience, you want to do what's called a debrief. And a debrief is where you really talk about that experience, not only just how it felt, what your thoughts were, but as you begin to reflect on it, what was the learning that happened? What would you do differently? What do you think unfolded? What questions remain for you? And so often the debrief can happen either face-to-face. So if you're doing a face-to-face simulation, you can have a live debrief right after it, or you can have a live debrief virtually. So everybody comes together and you talk about that simulation. You can also have a debrief that happens asynchronously, so via a discussion board with your small group members, and that's what's going to happen in this course, or self-reflection. So you can reflect on it yourself and really have some critical questions asked that enable you to really reflect on that simulation experience. And then finally, do you remember I said right before the simulation, we're going to do that pre-simulation self-assessment? It's also important that we revisit that and do a post-simulation self-assessment, same questions, but that really enables us to consider what's our level of confidence, what's our level of competence, what did I learn, where would I assess my, my continued gaps and my strengths. And so that post-simulation self-assessment is really important. Within this course, we're then going to ask you to do some work within your small groups, and that will become the focus of some of your synthesis postings. So we'll have some of those virtual sims. You'll have an opportunity to make the learning stick with some of the topics by engaging in that simulation experience, and then coming back as a small group, reflecting on it and taking that learning further through some kinds of activities and posting to the large group. And we hope again that that becomes an interesting way to apply knowledge. And I know a lot of you in that first week, when we asked what would be the best thing, talked about important to be able to learn new things, but apply it to my clinical nursing. And I'm hoping that through those simulations, that does help to make that learning really relevant and not just like you're reading a bunch of theory stuff. So bottom line, what does the evidence tell us? Traditional lecture, in particular when you have a very passive type of learning that happens through unidirectional communication, is not as effective as more engaging approaches. And so sometimes we pair them up, a little bit of lecture and a little bit of other stuff. So start with the lecture, that's the anchor, and then we engage in other kinds of activities. There's tons of educational theorizing around what's the best way to teach, what's the best way to learn, particularly discipline by discipline. And nursing has moved to this idea, and we've talked about it here, of collaborative transformational education. And that focuses on your own development as a person and as a professional. So it's not just give me the information, it's what does this information mean to me? What do I do with this information? how do I think about this information? How do I appraise that information? So a lot of that reflecting and contemplating and using the thinking strategies that you'll develop as you move through the program. I mentioned this before, isn't this fascinating? There's no evidence when we've been using clinical education as that model, that apprenticeship model for bringing theory, the learning that happens in a classroom or formal learning into a clinical setting. There's no evidence that tells us what is the dose. What do we need to be exposed to in a clinical setting in order to say we are confident? Do we need to have to look after a variety of patients, adults, children, older adults? Do we need to look after people with a variety of conditions, chronic conditions, acute conditions? What do we need to have? We don't have evidence that tells us there's nothing that applies across all situations. And so it's important to recognize that while we have done traditional clinical learning, because that's what we've always done, there is no evidence that says that is what is best to do. I would never say we're not going to have clinical in a traditional way, but it's important that we open our minds to possibilities of other ways to either augment or replace, and even, I prefer a better word to say, there is a new way of doing clinical learning that stands on its own. So it's not a replacement because we're not able to get clinical. It's not a replacement because of the circumstances we find ourselves in. It is a new way that is well evidence-based to provide clinical education. And so simulation-based learning in both face-to-face and virtual formats, we have copious amounts of evidence to say that it's highly effective, that it leads to enhanced learning, improved confidence and competence, and enhanced student and patient outcomes. Isn't that everything we would want? So hopefully in your learning opportunities throughout this program, and as you engage in teaching and learning with your patients, in your careers as you move forward as RNs, that we bring in all kinds of learning methods just to various situations. More and more, I think it's helpful to consider what is the best way to teach. So if somebody's going home and they have to be able to change their colostomy bag, when we teach someone how to do that, that's kind of a simulation, isn't it? And so we wouldn't just necessarily use words, but would we follow those, like a lecture, but would we follow the steps of a simulation that involve some preparation? And could that preparation involve reading materials and other things, the way we would do a simulation? So broaden that, our understanding of how we're going to do that teaching to include all of those elements. Are there moments when we would do presentations, more formal presentations, or provide different kinds of materials, or actually give someone an opportunity to apprentice in some kind of way? So important to consider all of those educational approaches. What fits for you? Develop your own understanding of yourself and your learning needs, and also recognize how we can excel in situations that we have yet to experience and may find that they are, in the end, perfectly suited to us when we would not have known that before. Important readings. Remember I said moving forward, it's important that you take ownership for your readings. There's a really wonderful article by our dear Leslie Graham that is so well constructed in describing the 3 different learning environments, classroom, whether that's virtual, online, or face-to-face, clinical environments, and simulation-based environments, and really helps to nail down the evidence, the strengths and where gaps may occur. So I invite you to read that. You are responsible for that within your work. I hope this has been helpful, and I look forward to continuing the conversation.